Hello, everyone, and welcome to the Beautiful Struggle. I'm Shanice.
I'm NECA.
And I'm Brian.
The Black Advancement is a nonprofit organization that seeks to create unity within the Black community through action and discussion. Today, we're going to be discussing the health gap and why it persists. There was a discussion on why the health gap exists, and now we're going to go on to why it exists. Why it persists, and then we'll come together as a whole group to discuss solutions to this problem. All right, so each panelist is going to give their spiel why they think it exists. Then we'll discuss it or persists, sorry. Then we'll discuss it as a whole group. And then at the end, we'll discuss solutions if we have any. All right. So I'll go first. Why do I believe the health gap persists? One of the main reasons I think the health gap persists is genetics. Black people and people of color, BIPOC people, are more likely to be prone to diseases such as high cholesterol, hypertension, diabetes. And I think just like we carry the traits for brown eyes and short and tall, we also carry the traits for those diseases that have been in our families for years. Yes, we can do a lot to combat it, but sometimes it's just in your genetics, and that's the cards were dealt with. So that's one of the reasons why I think those are the health inequities within our community exist, because genetically we are prone to certain diseases. It could be because of the food that our body hasn't quite adapted to, being that we're not from this country and we were brought here. It could be a variety. It could be the fact that we have social injustices and our bodies experience stress. So there's a lot of reasons that can contribute to the change in our genetics, but it's there. It's there, just like brown eyes, diabetes. Let's hope we don't get it. Don't get it though. Another reason I think it persists is social inequities. We have, of course, we discussed the wealth gap. We discussed the education gap, but all of that pulls into understanding our health and being able to seek proper medical care on a timely manner without having to wait until it's an emergency. And I know a lot of young people, we don't go to the doctor until we're old. And then by the time you get to the doctor, it's too late. Because a lot of times we don't get jobs that have insurance. So it's more expensive to go to the doctors. And then in some communities where you have jobs that aren't that do not offer insurance, you can't go to the doctor and get a checkup to let them know that, okay, your cholesterol looks like it's a little high right now. What can you do to bring it down before it's too late? And then you think about the environmental factors in a lot of rural and urban areas. May have poor air quality. A lot of people live in food deserts. I read a statistic. It said off of closing the health gap.org. It says 39.4 million Americans continue to live where it is easier for them to buy grape soda instead of getting a handful of grapes. So if you have that as a factor, and a lot of those food deserts are within Black community, we don't have the equal access to healthy foods and vegetables. You also think about access to recreation, such as parks and stuff. Like, they don't build them within our community. A lot of times we are like neck to neck with each other, living in these small urban communities with not a lot of space to go out and run around the track or something like that. So and those were my reasons. So I said I'll just sum up: genetics, social inequities, and environmental factors were my reasons why I think the health gap persists within our community. All right, we're going to go with NECA.
Okay, so I actually disagree with you about genetics.
Okay.
I think that what we're seeing in Black Americans is not a genetic issue. I think it's more of a function of institutionalized racism and the weathering and the toll that it takes on our mental and physical health. And I think that's where we see the differences, as well as like, the things you mentioned, like structural or environmental racism, where there's food deserts. Also, people who are struggling financially may be working long hours and not have the luxury of prioritizing working out. They don't have the time. Sometimes they're working multiple jobs, working really long hours, working a lot of overtime, or don't have the money to eat healthy, because we know in this country it costs more money to eat healthy. So I don't think this is really genetics. I think it's just a terrible setup we've been put in based on the history of racism in this country. So that's one thing. And then also, I feel like, we do talk a lot about food deserts, people not being able to afford healthy foods, which is true for people who are struggling financially. But, all Black people aren't struggling financially. And I think for those who are doing well financially, sometimes you still see some of these issues of, living a more sedentary lifestyle, not necessarily eating the healthiest food, not prioritizing exercise and being active. And I think as a culture, as a community, we have to kind of work on that. And again, that is something for people who have enough money to do these things. It's going to be more difficult for people who have financial challenges. I think that is a big issue. And then going back again to the institutionalized racism and the history of healthcare in this country, there's a lot of fear and a lot of, people who may not trust medical recommendations, may not be visiting their primary care provider regularly to maintain their health. If they have chronic conditions, sometimes they may not take medications as recommended. They may not be following up as recommended. There may be issues where they're not treated well when they, interface with the healthcare system, which, feeling discriminated against, the bias that may be coming from healthcare providers, it's not encouraging to keep going back and, listening to what they're saying. You don't have a good relationship there. It sets you up for health issues. People not wanting to take medications, like distrust, like thinking about like vaccines and COVID and all these things that have been going on recently. So I think there's so many things. It's a lot to discuss that we'll get into today. But I think to me, the biggest thing is institutionalized racism, and most of the issues fall down from there.
So, Brian?
Both of you guys have very good points, and I agree with NECA. I don't think it plays much of it as we, I guess, learn more and more about science and new developments come out. I think it's less about genetics now, so I'll agree with her on that. And my points that I brought up, it's more about education. I'm going to keep it as plain as that because I didn't, do a deep research into it. But what I mean by that is that I use myself as an example. Like you said, going to the doctor regularly as a 30-something-year-old male, or even a 20-something-year-old man, that's not something that we're taught to do whatsoever. And it's important. You should be doing that as an able-bodied adult. The time you're 19, 20 is going to the doctor regularly, getting checkups, even at that young of an age, because you never know. I've had people that I've known that were 20-something years old that died of colon cancer. Now, if they would have went to the doctor regularly and had regular checkups as they normally were able to get or could have gotten, that could have been detected earlier. He probably would have still been alive today. It's just one example. But education, I think, is a big factor in that. And the poor quality of care was a big factor that I researched also too. And what I mean by that is that, like you said, people may not have jobs that provide a good quality of insurance, so they have to resort to, going to urgent cares, like something that's not as good as like going to Johns Hopkins Hospital or something like that, or a doctor that's affiliated with Johns Hopkins Hospital. So, and then they'll do a thorough checkup of you as opposed to just taking you as a number. So that's another thing. And that could discourage people from actually wanting to go and seek care or stop them from getting care in general. But going back to education, just knowing that you can, at 30 something request a colonoscopy, a prostate exam, even as a 30 something year old male, getting other things checked like your eyes, going to the dermatologist and making sure that everything's okay with you. These are things that, may seem minute and are not taught in school or in our culture, but those are things that can lay a foundation of actually closing this disparity that we see amongst, blacks versus whites or any other um, culture or race for that matter. So that's my points that I actually saw and thought was important.
All right, awesome. Yeah, thank you guys for that. That was many good points that you made. All right, Artie. Sorry, Aji's talking to me. So we'll go ahead and we'll have a full-on discussion right now about each other's points, and I understand that you guys disagree with me about genetics, but I do think they do play a part in it too. It may not be as prevalent as you guys say, but I know people for a fact that have had cases where everything else is great, but then they end up with something that their dad has or their mom has, or so I think it plays a factor, but it could be because of all the other disparities. I agree with you, NECA and Brian, when you said that quality of care when you get into those facilities, even if you are going to the doctor, the fact that some of the doctors may not even believe you. I know that's a lot of case where it comes to like Black women and trying to be heard, especially when it comes to like maternal stuff. A lot of us aren't heard or believed. And then we can talk about why go back to the whole Black people have a high tolerance of pain and stuff like that. So there's a lot in the medical field that has to be changed too, in order for, I guess, for Black people to feel even comfortable going to a medical professional with an issue.
Mm-hmm. I just wanted to make a point about genetics and disease processes. There's been studies and documentaries just looking at oppressed people across the world. They looked at African Americans. They also looked at Native Americans or the indigenous population here in America. They looked at Aborigines in Australia. And all of these populations have the same issues with high rates of diabetes, high blood pressure, high cholesterol, all of these things in common, increased rates of cancer, stroke, heart attack. And I think, that shows that there's some commonalities in being a group that's heavily oppressed in your country. And from that circumstance, you'll start to see some of these disease processes occur. So I think sometimes it can be tricky and confused a bit with genetics, because maybe, yeah, like you said, it could be, maybe everybody in your family had colon cancer, but part of the reason that's occurring could be because of all of this oppression and racism that people are dealing with. Although, there are just, some genes that, like BRCA1, BRCA2 for breast cancer, some things you can trace, and, it can happen both ways. But I think just seeing how you can see the same issues going on in all of these oppressed populations, kind of lends credence to the fact that that weathering plays a big role in what we're seeing too.
Yeah, I agree with that too.
Yeah, I agree. And then also too, like, I mean, culture is a big factor too, because that determines a lot of times what you eat. So you may or may not be in a food desert, and you may still not be eating healthy regardless, because of like who you are around all the time. If you're not a person that's educated, or not necessarily educated in the sense of going to university or something like that, but like just knowing that, this food is going to actually kill me down the road. I need to step away from that regardless of what everybody else is doing, then, nothing will ever change in that respect. So a lot of that also plays into the genetics argument too, because you can say it's genetics, but a lot of the times you look down into the culture from generation to generation, depending on what they eat, a lot of the times it comes down to that, and the lack of exercise on top of that, really, because there are other, we're not the only race that eats fried chicken. This is the fact of the matter is, but if we're not bike riding, mountain biking, or, cruise biking, like, Lance Armstrong, like that, if that's not part of we're never going to be able to get over that hurdle and stop, diseases from happening, or at least put a buffer in between that. And I had another point too, because actually I've been going to this doctor down in Germantown. She's a Black doctor, and this is the first time I ever like had a doctor ask me about my diet, making me journal, talking about nutrition in general. So um, it's eye opening to me, and it's just proving our points that all the doctors I had previous to that never took the care to even ask me about that or include that in my care. So if you're not getting that, based upon where you're from or your race or whatever it may be, that plays a big factor. The doctors and the care providers that are supposed to provide this care, they have to step up and provide it across the spectrum, regardless. So,
Yeah. Another thing I was thinking about too is also some of these, people may be employed, but if they're not provided sick days or PTO, it can become very difficult to address. Like if you're living with, I don't know, whatever it is, maybe you have lupus and you have regular appointments, you're supposed to follow up with your rheumatologist every 3 months. And, your job is not such that, you can get paid when you have to take time off. And so there becomes a choice between going to that and being able to pay your bills. So people may get behind on what they're supposed to be following up with. And then now something is at crisis level with their healthcare, and then they go to the ER or the urgent care because it's, off work hours and they don't have to miss work. And so I think that's another thing that can contribute with some of these positions that don't provide paid leave, can be a problem. And then not only just physical health, but mental health. Some of these insurance companies have very, very poor coverage for therapy and mental health services, and they can be very expensive out of pocket. Or they will, the other trick that they do is they will, like some of the Medicaid, right, which people shouldn't have to, they don't pay for their Medicaid healthcare or mental health, but the insurance company reimburses the clinician so low that they don't accept this insurance. So that it becomes, the insurance will pay, but the person can't find anybody to go to. So essentially, it's not doing anything for them. So there's those kind of things that happen. Dental care too is another thing. Dental care for adults is not covered by Medicaid often. And we know that dental care, good dental health is linked to other markers of good health, like cardiovascular health. Right. And so if it's just, it's not happening, and dental care is very expensive out of pocket. So it's definitely just going to be foregone if you don't have the finances to afford that. So there's a lot of structural things that cause big problems as well.
Yeah, a good portion of dental care, it's like a lot of it's cosmetic too. Like it won't even cover it to a certain extent.
Right.
With commercial insurance, yeah.
Yeah. That's definitely a good. Okay. No, go ahead. I'm sorry. No, I was just. I literally about to say the same thing. Sorry.
Saying good points overall. Very good point. Something that you mentioned, Neka, that I didn't think about was the dental hygiene link. So because I know, like, if you go to because we go to a Black dentist now, and she's very thorough with her cleaning, and then she lets you know this is linked to this and this is linked to that, and we can tie back into just like Black doctors and how important they are, because they tell us the truth. I think a lot of times with other doctors, we may not get that same response. I don't think if I was going to a white doctor, which I have, I went to a white dentist before, but they never gave that education, like Brian was saying. So it's important that we are represented in those fields, because we can let other people, our people, know, hey, if you don't take care of this, then this happens. If you're eating this kind of food, this is going to happen to you. And I think
Right.
it's important. That's kind of like a solution, that we have more Black doctors that are willing to educate and talk to us about our healthcare.
Right.
Yeah, I agree with that for sure. And not only Black doctors, Black everything, nurses, nurse practitioners,
Mhm.
physical therapists, occupational therapists, like all the positions, pharmacists, like it's really important. That education piece you're speaking to is key because I feel like personally, I have all Black everything. My dentist, specialist, primary care provider, I seek that out. And, that also is a privilege based on where I live. That's definitely not going to be possible for every Black person. But I definitely seek that out wherever I live. I need a Black provider. Although it's not, 100%, because there are some, fools in every profession, right? But I would say it's you know I think for me, it's worked out well for the most part. And for those who I didn't really jive with, we moved on quickly. And as a nurse practitioner, when I encounter the healthcare system, I don't tell people what I do. I like to see how um, providers treat me, not knowing that I have a medical background. And I have seen some things and some foolishness. And the lack of explaining things properly, or I might ask a question, even though I may know the answer, as just as a layperson to see what they say. And sometimes some of the answers they've given, it's like, it's kind of sketchy. So, and I think that education piece is really important. Explain to people why you're recommending this, can be very important. As just instead of just saying, take this, like let people know this is what I'm concerned about. This is what I'm seeing in your labs. This percentage of people go on to develop this. Let me know if you have any issues. If it's a medication, let them know these are some side effects you encounter. If this happens, call me. We can change the dose. Education is really important to kind of giving the patient a full perspective of what's going on. And I think that piece gets missed a lot with bias in healthcare, unfortunately.
Yeah.
Agree. Definitely agree. I mean, NECA, you're right on point with that, and like it's something I encountered, heard horror stories of people that encountered also. Um, Thankfully, I've just been able-bodied. Even if I had a sedentary job, I still would go out and walk. So that's a lot of those things are important to combat these disparities. Is just taking to play devil's advocate. A lot of the times we got to take personal responsibility of our own health too. So
Yeah.
we may have these boundaries or these adversities in a job place and workplace, but still, like, we have to like take our health into consideration and actually, maybe sign up for the gym and go 10 minutes 2-3 times a week to, get our bodies moving and create that energy you need to be able to do all these things. So those are things that are very important. And encouraging people. I think it's important for us to, as a culture, to understand that if we start in the house first and take personal responsibility and work out everything in our house as far as eating healthy, exercising, prioritizing mental health by, speaking positive things or actually seeking therapy wherever we can. A lot of times you can go on YouTube and actually hear somebody speak about a situation similar to you, and that could be a form of therapy also. So, for people who don't have that type of insurance or have those resources, those are alternatives for the time being until you can better your situation. Just to throw that tidbit out there. Um, so I think those are things that we can do. I'm getting into the solution part of it because it's just, I don't know, it's naturally just came out. But I think those are things that we can do to help out with these issues.
Even with your point to mental health, because mental health factors can contribute to physical health factors too. So if we're not,
Greatly, yes.
seeing a therapist and we have a lot of emotion and everything's bottled up inside of us, that can lead to high cholesterol, it can lead to high blood pressure because you're stressed.
Right.
So yeah, it's important that we as a community emphasize, healthy mental health as well as physical health, because all of it's connected, mind, body, soul. We
Sure.
make sure we're taken care of.
Right. And socioeconomic is definitely a factor when you talk about, like, wealth, income, education, and racial privilege and whatnot. But like I said, those things are true. They're there, and they're real, and they, hinder people from getting the healthcare that they do have. But eating healthy, it is expensive, to a certain degree, but you can literally get ingredients to make a salad very cheap and spend less than $20 to do that, to eat for 3 days. I mean, I've done it. It's just the choices that you make. It may not be pretty, but at least you'll be healthy. And I think that personal responsibility piece is very important and lacks to a certain degree in our community. But on a grander scheme, is obviously there are still points that you guys brought up that hinder us from actually getting the healthcare that we need, and especially when you're talking to doctors. I mean, if your doctor is not is not showing the best interest for your health, it's very disheartening because you literally don't know anything about the medical field, and you're relying on this person that you're paying to provide that care for you. That's disheartening. So yeah.
I'm going to admit one person. I think TJ is showing up. So
Oh, cool.
let's welcome TJ, everybody. I think he should be coming on soon. There he is. Hey, TJ.
Hi.
Hi. So we're in the middle of the session right now. Everyone gave their points on why the health gap persists, and now we're just discussing the points that we made. So if you want to go ahead and give your points, you are welcome to, and then we can add on, and then we'll close up with our solution.
All right, thanks. You didn't have to surrender the floor to me. I apologize for being late. I was stuck in traffic. I'll probably make very similar points that everyone else made. I'll keep it very quick and succinct. I believe the reason why it persists is because there's so many, linkages between our reasons for the health gap in the first place that haven't been addressed, right? So, for example, where our communities are. Sometimes we're put in a position where we're kind of in a food desert, right? What you need from a nutritional standpoint is not close by. It's not easily accessible. That's one reason, of course. Another is access to good healthcare. That's usually a problem that can stem from proximity to good healthcare facilities. From that, and it also can be because of employment. Like most of us enjoy decent health coverage because our employer has that as part of the package for you to do services for that company. But if you're in a position where you don't have healthcare as part of what comes with your job, it's going to be very difficult for you to afford healthcare that is going to be sufficient to keep you healthy, and in some cases to get you healthy if you've already gotten to the point where you need some serious help. The legislation piece we all know about it. You guys probably covered that as well already. None of that has been changed since, was it 2010, I think, something like that. And lastly, I think this one, maybe there's been a little bit of improvement. I'm not exactly sure. I would say the access to information about how to properly take care of yourself, because we tend to be in areas that don't have as good of connectivity from an internet perspective to the rest of the world. We may not always have the same kind of access to that information, but I think maybe that area has gotten a little bit better over time, but not enough to bridge the gap.
All right, anyone really want to reply?
Yeah.
Well,
no, yeah, you covered a lot. We didn't really get as much into legislation and universal health care and things of that nature. So I think that was a good point that you added on. And the other thing I wanted to just hit this point again, which Brian brought up about personal responsibility, because, we speak a lot about food deserts and people who, are underemployed, unemployed, and don't have access to healthcare. But, I see a lot of people who are doing pretty well, well educated, well informed, bright people who, started their own businesses, very successful, know, the things that they should or should not be eating, and still continue to eat those things. Like you were mentioning something about a salad, and people, I guess it could be, lack of education as far as, anybody can find a salad that they'll enjoy eating, but some people think it's just literally like iceberg lettuce and some carrots and celery, and you throw a little whatever oil and vinegar on top, and they don't enjoy it. There's so many different ways you can make salad. There's something out there that everybody will enjoy that's healthy, and I think people do get into those routines of eating the same things that they're used to and don't really want to venture out of what they're used to and try different things. And as well as like not having time to work out. I mean, people, we make time for what we want to make time for. A lot of times people are, spending an hour or two on social media a day, and that hour you could have been out there getting a walk in. I mean, even if you're looking at your phone the whole time, at least you can be walking and looking at it at the same time to get that activity in. So I think there's different sets of issues depending on where you are financially. And I do think that personal responsibility piece does not get brought up enough, because there are people who have the knowledge, or if they don't have the knowledge, they could easily figure out how to get done what needs to get done. And for whatever reason, they're kind of stuck in this pattern where they're not going forward. And I do think part of the issue in this country is some food addiction. And all of these additives that are being put into the food, excessive sugar being put into everything, which is quite addictive. And it becomes very, very difficult to change your eating habits. And those eating habits start very young. So for people who are parents and children, like the next generation, usually by the age 2 or 3, food eating patterns are set. So it's really important for us to do that for ourselves, but also people who are parents, looking at the next generation, it starts very, very young with healthy eating. And you want to make sure that you influence your children in such a manner that they can continue to go forth with healthier eating habits as well.
Agreed.
Sorry, Ryan. Go ahead.
No, I just say I agree. Go ahead, TJ. Sorry.
There was one more point that I wanted to make that I completely forgot about as far as the health gap piece goes, and that has to do with being Black in this country is a more stressful situation. And that stress, I mean, we know that stress can cause a litany of health problems. So even though we're taking care, even if we have the knowledge and understanding, and we're trying to take care of ourselves, there's still the everyday stress of being Black, and that leads to hypertension sometimes, heart attacks, high blood pressure. The list goes on and on and on. So that's another reason for the gap, because it is very stressful. I mean, it's been proven scientifically that we're under more stress in this country just for being, who and what we are. But your point about personal responsibility, that's a fair point, I think. I don't know how many of us fit into that category versus the whole, but there are definitely some that choose the unhealthy lifestyle, I'll say.
And it's a struggle. I struggle myself with it every day, trying to make the right choices. Don't feel like going to the gym. Would rather lay up on the couch. But I mean, when you really think about it, like our health, like what is more important than that? Like it's crazy. It will literally take you off this earth. Like it has to be prioritized. Like what is more important? It doesn't really, when we really think about it, it doesn't really make sense. Like, okay, therapy is important. And it may be expensive. It may be $50 a week. But if you think about the benefit you can get from it, like, it's not necessarily going on for the rest of your life. It may be a limited time period where you're going every week or every other week, and you're maybe paying a couple $100 or $100, or maybe if you can only go once a month. But when you think about the way you may spend that money in the course of doing other things, the return on your investment is really, really high for therapy and getting mental health treatment. So it's expensive, and it shouldn't be that expensive. And, it would be nice if these things were just paid for completely, universal healthcare, including mental health and dental, all of it. But we're not there yet. And we just really have to just think about prioritizing that as best can be. And I think a lot of times people kind of almost, it's like when they get the diagnosis, they start to try to make the changes. But, if we're just like throwing the sugar down, everything is like sugary drinks, eating a lot of sugar, eventually, and everybody in your family has diabetes, I mean, it's coming for you eventually, right? So instead of waiting for the diagnosis to make the change, we have to just prioritize kind of preventing those things. And it's hard, but it's really important.
Yeah, that's an excellent point. And a lot of high performers in workplaces, like, that don't prioritize their health, it just doesn't make sense, because you can perform high or at a high level for just a certain period of time with bad health. You can prolong that if you actually take care of your body and take the time off, and get the 8 hours of sleep consistently, things like that. Fix your diet. They'll actually carry your career a lot longer. And a lot of times, in this country, we don't think that that's the case. It's like, you hit the ground running, and then you just don't think about anything else. And I made that mistake, myself, but I had to dial it back and say, hey, look, you need some time to yourself. You need to make sure that you're not up, watching movies and when you should be asleep, to be able to get ready for the next day. Or actually, instead of watching a movie, go out for a walk. Instead of being on social media, go out for a walk, or do exercise, or do something that's actually going to, stimulate your mind to help you get off of things that may stress you out. And TJ, sorry, you brought up a point earlier about stress, and I think that's a very good point, because a lot of people that live in inner cities that are like, live closer together, that have higher concentrations of violence, and may see things like trauma related incidents that actually may not seem like it plays a fact in their life surface level, but like deeply, actually, it actually plays a part in them. And they never get that stuff addressed. And over time, and just like it's ingrained in them, and they actually tend to be more aggressive. And if they never have any like therapy to address those issues, that actually leads longer down. There's been studies that actually show that that leads to poor health later on in your life if you don't get those things addressed. And without education, or even knowing that, hey, look, any type of trauma, it could be a bully in high school, it could be you see somebody get shot, it could be police brutality, whatever, bomb going off or a mass shooting, anything. It's even something minute as somebody. Yeah, right. So even something as minute as seeing somebody getting robbed, or you being robbed yourself, is traumatizing. Right. And if you don't get those things addressed, or take that time to process, it'll be bad for you. Long story short, and actually, somebody in that position could have those things happen to them in the inner city, not have a good job that has insurance. They may not be able to take the time off to process that, because they got to go to work, or they're on their last strike, or whatever. They may not have any PTO days off. And it's just a rolling effect. And then that causes them to be aggressive towards themselves, their coworkers, their children, and it's like a snowball effect. So those are things that definitely need to be addressed, and should be, and should, their circumstances for people outside of their personal responsibility should make it easier for them to address. And that's the problem I think we have in this country.
We're going to have to wrap up in a couple of minutes, but before we wrap up, does anybody have any solutions to this issue that they want to offer up?
Education, man. I think it comes down to that. Even the personal responsibility piece that NECA was describing. If people know better, but they were raised when they were 2 and 3 years old, I think you had said building habits from that point. Mm-hmm. If that's the way that you came up, maybe once you grow up, maybe you know better, but you don't do better, because that's not what your habit is, right? So education on how to take care of yourself, right? Education, and that includes everything from diet to exercise, right, to the mental health. That's a really good point. I hadn't really thought about that, but that is a really big part of health as well. So to me, that is going to be one solution, right? Educating our people better on how to take care of themselves, and maybe also trying to break some of the cycles of distrust where it's not necessary. So for historical and good reasons, I think our communities have less trust of people in the medical field that are supposed to be treating us than other communities do. But we're going to have to, find good and competent, medical people to help us so that we can break that stereotype as well. Because preventative care, if you have no trust, then the preventative care aspects, you don't do that, right? Because you're trusted. You will feel that you'll either be misdiagnosed or overdiagnosed, or you feel like you're better off without doing that. So those are things that I would offer as potential avenues to get us to a better state of health.
Okay. Anybody else have any solutions?
Yeah, I would, like I said before, if you can find Black healthcare providers, I think that can be helpful. And then, the other thing is, I mean, try ending racism. That's a big one, but very difficult to tackle. But I think, money talks in this country. And I think that if legislation is passed that can kind of incentivize hospitals and healthcare systems to reduce healthcare disparities, first of all, the healthcare systems need to look at the data and look at outcomes for Black people, all races of people, and then look at ways they can close the gap. And I think, for certain things like in the hospital, let's say somebody gets admitted to the hospital, they get discharged. If they bounce right back to the hospital within a certain amount of time, the insurance company is not going to pay the hospital. That's on you guys. You discharged them too early. You didn't give them good care. There wasn't proper education. You're going to eat the cost of that patient's rehospitalization. So I think if we look at kind of things of that nature, like, okay, we're noticing when Black people go to your hospital and they have surgeries, they have a higher complication rate, they're bouncing back, they're having all of these issues. Maybe we're going to reimburse you guys a little bit less until you get this issue together. And I think a lot of times it comes down to the financials to get them to pay attention and to do things differently, unfortunately, but that's what it is. I mean, you can say stop racism, but I mean, how are we going to realistically get at that? I don't know. But I think some of these kind of structural things that we can influence may be a little bit easier. And then, of course, universal healthcare covering, like I said, physical, mental, dental, all of the stuff. And then I think jobs, I mean, we need sick days. People need PTO at the jobs, period. Like every job out here, people need PTO. That is a big issue too.
Brian, do you have any solutions?
Just piggybacking off of what they're saying, nothing too much different. Education, and like I mentioned earlier, starting within the house, but having health professionals like they do now, outreach programs to educate their communities on small things that they can change that are manageable inside the house or within their own lives. And then the people receiving that information, taking it seriously, and encouraging people to do it. So that's a solution. And Neka made a great point. Money talks. So changing legislation so that care providers, hospitals, are incentivized to take care of the people that are admitted, to actually fix problems, and not just filter people in and out based upon whatever they do now. Long story short. And another thing too, not to get too granular, but nutrition within the hospital, I think it should change too. If you're in the hospital, there's no reason why I should have fruit cups with all the sugar in it.
Yeah, that's true.
Canada Dry Schweppes ginger ale, which has a lot of sugar in it. Small things like that. I see those things and I'm just thinking like, okay, I think things like that in this country should change. Like I said, I didn't mean to get too granular, but I think that those are things that can definitely change. There's one other point I wanted to make. I'm trying to remember it. Healthier food options. So, people gardening and actually being interested in agriculture is very important, because then that's going to actually close that gap for food deserts. So if us as a culture takes that more seriously, or have a greater interest in that, whether it's entrepreneurial interest or consumer interest in that, I think that'll help too, because then it won't be any food deserts if that's something that's part of our culture. So that's another thing.
And I would suggest having a network of Black doctors within each city. Like if you live in Frederick or if you live in another city, that you can have like a network list of these are the doctors you should go to within each city. I think that would be cool. So that way they have to be vetted, of course, but that way we are making sure when we do seek help for our health, we already have this vetted group of doctors or psychiatrists or just something along that lines. That way it takes care of that mistrust that a lot of us
Yeah.
have. And then off of Brian's point with the food desert, having our own gardens, and I think they do community gardens in inner cities. I think I've seen that
Yeah.
a lot. So if the vegetables and the fruits aren't coming to us, then we can have community-based gardens within all these areas that have food desert that will help with the healthy food, and then education as well, teaching them what to do with the food and etc. So having education along with options for healthy foods and vegetables, and then go on a national challenge. Just say, hey, all Black people walk 30 minutes a day, like, or just, just something like we do these TikTok challenges, then like maybe we can do some health challenges. All Black people do this, I think those will be. And then, and speaking of universal health care, that racism is is the reason why we don't have universal health care. Because as soon as Obama left, guess what Trump did? And even if you talk about schools and healthy school lunches, that initiative went out the door too, because of who we have in office. So make sure we get out there and vote for the right people, so that we can change some of this legislation. Hopefully we have everyone that wants to change it and they realize the disparity, but they won't because they want us gone. But yeah, so as far as relying on the government, that might be something that's kind of like a high hope. But that's it for the show. So that's all for today's beautiful struggle. Thank you for watching. You can see this and more at the Black Advancement YouTube channel or on the website www.blackadvancement.com. Until next time, peace and advance.